Melanoma is not one of the most common skin cancers, but unfortunately it is the most deadly. Luckily, if you pick melanoma up early, it's almost 100% curable, so it's very important to know the difference between a regular mole and a melanoma. And so what we have is the A, B, C, D, E rules. We'll go over those rules. The first rule is the rule of asymmetry. If you look at this mole here, that's just nothing to worry about. It has, if you look at the left side and if you folded this mole in half, the left side and the right side look essentially the same. Here's a melanoma where the left and right sides, you couldn't fold this mole in half. They don't look the same. B is border. Here's a regular mole and the border is nice and sharp. The edges are nice and sharp. Melanoma, you have the edges sort of fading into the skin, very irregular. C is color. Uniform color, looks the same all throughout. This, you have a little bit of brown, a little bit of black, different colors throughout. D is diameter. What we're looking at is about the width of your pinky. Here's a smaller mole. If it gets bigger than the width of your pinky or bigger than the size of a pencil eraser, then it could be a melanoma. E finally is evolution. If a mole starts off small and normal looking and then all of a sudden it changes colors, changes shapes over a short period of time, that can be a sign that it's a melanoma. Very important to avoid things that might create melanomas. So sun damage is a big part of what you want to avoid. This is very important. The tanning booths, especially when tanning is begun at a young age, it causes the chances of having melanoma to triple, to go up 75%. So avoiding tanning beds, staying out of the sun as much as possible, wearing sunscreen and sun protection. So use the A, B, C, D, E rules to evaluate your moles. Try to look at your moles a couple of times a year. If you see a change, if these moles are violating the rules, then get in to see your doctor to have those moles removed. That's a Minute for Health.